Have you ever felt like you were trying to solve a puzzle, but some of the pieces just would not fit, or even made the picture more confusing? That is often how it feels when managing a complex health condition, especially when other factors get in the way. When it comes to schizophrenia care, substance abuse significantly impacts a person's journey by worsening symptoms, interfering with effective treatment, and making the path to recovery much more challenging. It creates a complex interaction that can derail progress and increase distress. The core mechanism is how these substances directly interfere with brain chemistry, which is already altered in schizophrenia. For example, substances like cannabis can trigger or intensify psychotic symptoms, while alcohol might initially seem to calm anxiety but ultimately disrupt sleep and medication effectiveness. They can mimic or counteract the very neurotransmitters that antipsychotic medications are trying to balance, creating a push and pull effect that makes medication adjustments difficult. This often leads to a cycle where individuals might use substances to cope with distressing symptoms or medication side effects, only to find those symptoms becoming more severe and harder to manage. The most effective approach for someone facing both schizophrenia and substance abuse is what is known as integrated treatment. This means addressing both conditions at the same time, often by the same team of healthcare professionals, rather than treating them separately. Practical steps include openly communicating with doctors and therapists about any substance use, no matter how small, so they can tailor treatment plans accordingly. Developing healthy coping strategies for stress or triggers that might lead to substance use is also crucial, along with building a strong, understanding support network. A key term here is dual diagnosis, which refers to someone having both a mental health condition like schizophrenia and a co-occurring substance use disorder. Recognizing this dual diagnosis is the first step towards specialized care that provides coordinated support. These integrated programs often include therapy types like cognitive behavioral therapy and motivational interviewing, which are highly effective for managing both conditions simultaneously. They also focus on relapse prevention planning, teaching individuals to identify warning signs and implement strategies to avoid returning to substance use. Ultimately, addressing substance abuse directly in the context of schizophrenia care is not just about stopping drug or alcohol use. It is about creating a stable foundation for symptom management, improving the effectiveness of medical treatments, and empowering individuals to build a more fulfilling and independent life. While it presents significant hurdles, integrated and compassionate care offers the best opportunity for long-term stability and improved well-being.